just about to start our flow for today. So today is a relaxation flow. Before we start the breath work, we're just going to think about our connection and doing a few postural cues to sort of get us better connected with the floor. So where we should be feeling connection is between both our feet, underneath the pelvis, or underneath the lumbosacral junction, which is the junction between your lower back and pelvis, underneath the TL junction, which is the junction between your upper back and your lower back, underneath both shoulder blades, and then underneath the back of the head. So if you're not really feeling those, don't worry, because we're going to be going through a few little postural cues now. So with your feet, you want to think about whether you're feeling the pressure equally from side to side. If you feel like there's more on one side than the other, you're just going to sort of shift your weight a little bit, try and balance that out. You also want to think about whether the weight you're feeling is equal on each individual feet. So if you can feel it side to side, so the medial and lateral arch, and front to back. So if you're feeling it more on the outer part of the foot, just try and bring your foot down on the inner part, or equally if you're feeling it more on the inner, try and bring it down on the outer, so that everything's nice and distributed evenly. Okay, so we've got our feet, we're going to work our way up to the pelvis, and what we want to do is get our pelvis into a neutral position. So we're going to start by tilting the pelvis, so lifting the pelvis away from lifting the spine away from the floor, and then you're going to reverse peel and you're going to indent your spine into the floor, and then peel it away and reverse peel and lift. So we're just rocking our pelvis backwards and forwards, so rocking it into an anterior tilt and we're rocking it into a posterior tilt. So keep doing that, just learning how to move your pelvis backwards and forwards. So we're lifting the spine away from the floor and then lowering it towards the floor. Lifting and lowering. Lifting and lowering. And then you want to stop in the midpoint between the two end ranges, so that will give you a neutral spine. It should be a neutral pelvis, neutral position of your pelvis, and with that position you shouldn't feel any gap underneath your back. You don't want your back to be arched into the floor, but you don't want there to be an arch under, so that you can get your hands underneath. So it should be nice and flat, and that'll give you your neutral spine. And with that you should feel better connection between your lumbosacral junction and the floor. And now we're going to work our way to the rib cage. So your rib cage and your pelvis should be parallel. So what we want to do is imagine that your rib cage and your pelvis are like the pages of a book. So what we don't want are for the pages to be open. So if they're open, you get this flared rib appearance and you get this gap underneath your back. So we're going to get our pelvis into the right position again. So imagine that your pelvis is right. So you've got your closed page of your pelvis. And now what we want to do is try and close the pages together, coming from the ribs. So the ribs want to close towards the pelvis. So you're sort of going to try and bring them down. And we're closing the pages of the book. And that should feel like there's a bit better connection between your TL junction and the floor. And now your rib cage and your pelvis should be in a nice parallel position so that they can communicate better when you're breathing. So it'll activate your core muscles better. And then you want to think about your shoulder blades. So try and make sure that they're equally on the floor, both sides. So you should feel it equal, both sides. And you want to think about your shoulders and that they're in a nice neutral position. So to get them in a neutral position, so if they're feeling like they're a bit forwards or up by your ears, what you want to do is try and externally rotate your shoulders and depress them. So when I say depress, you're trying to bring your shoulder blades down towards the back pocket. So you're using these muscles at the back of the shoulder and down underneath the shoulder to pull and externally rotate into a neutral position, but you don't want to retract them, so you don't want to pull them back towards the floor. And then we're going to work our way up to the head. So the back of the head wants to be in contact with the floor, and you want to try and push your head down towards the floor, so you're looking up towards the ceiling. You don't want to let your head tilt backwards, and you don't want to tuck your chin down like this. But what you should feel is that when you push your head down towards the floor, you should feel these muscles at the front of the neck working. Okay, so we've got our connection, so you should feel nicely connected between your feet, your lumbosacral junction, TL junction, shoulders and head. So just try now to let any kind of tensions just melt away. So if you're feeling tense anywhere, just let the muscles relax. And now we're going to think about our breath. So put one hand on your chest, one hand on your tummy. So when we take a breath in, what should happen is your diaphragm should go downwards, and then that should create a pressure all the way around the abdomen. So when you take a breath in, the hand on the tummy should lift, and when you breathe out, the hand on the tummy should lower. You shouldn't feel anything happening through the hand on the chest. That wants to stay still. So we're just going to spend a little bit of time just trying to get the breath in the right order. So just try and focus on your breath. Don't think about anything else. Try and let all the stresses, worries, tensions from the previous weeks just melt away. So if we're just thinking about our breath, thinking about getting that in the right order. If you start to feel your mind drifting, just pull it right back to your breath. It's bound to drift. But every time you're noticing it drift, just pull it right back. And like I say, if you've done these before with me, just think of this as a meditation. So really focusing on the hand on the tummy lifting, the hand on the chest staying still. Just do a couple more breaths. And now we're going to put our hands around our waists, because when we take this breath in, this diaphragmatic breath, we want the diaphragm to be working efficiently. The whole of the diaphragm wants to be working. So we want to feel all the muscles in the abdomen activate and lift and try and push the hands away as we're taking a breath in. So I call it, well, it's called a 360-degree breath. Well, that's what I call it anyway. So we're going to grab hold, so find your bony bits at the front, grab hold with your fingers into these bony bits, web of the hand around the waist, and then the thumb sort of pressing and digging into the back. And then just to sort of wake your muscles up, to let your brain know where your muscles are, if you just cough. Feel all those muscles the whole way around expand and lift, and try and press your hands away when you're coughing. And now they're all the muscles that you want to think about lifting and expanding your hands away as you're breathing in. So take a breath in. Think about where those muscles were that you just felt lifting, and think about those muscles now trying to push your fingers away. To make it a bit easier, Breathe in through your nose, out through your mouth, through pursed lips. Imagine you're blowing through a straw. And you want to feel this activation equal from front to back and from side to side. Some people struggle with their back especially, or if you're like me, I always struggle to inflate into my right side, which is why I get a lot of right-sided issues. So just really try and focus on the bits where you're not feeling the breath, the expansion. If you need to, cough again, poke the muscles, just jab them a little bit, wake them up. So I'll think about your pelvic floor. So your diaphragm and your pelvic floor should mimic each other. So as you're breathing in, your diaphragm goes down, your pelvic floor should go down as well. So think of your pelvic floor pushing towards your feet. With this, practice definitely makes perfect. So if you've not done this before and you're struggling with it, just keep practicing. So even when you're not doing my flows, just practice sort of daily, as often as you think about it. The more you practice it consciously, the more subconscious it'll become, and you won't even have to think about it anymore. Okay, and the last little bit of the breath is the breath for me that I teach you is the brace breath. So when we say a brace, I don't mean clench or tense or sucking the tummy button in. It's an outward expansion, an outward push. And the cue that I use is just to imagine that you're farting. So day to day, the 360-degree breath is perfect. That's what we need to be doing all day, every day. But when we're doing something that needs more stabilisation, so when you're carrying the kids, carrying the shopping, lifting weights, anything like that, you need to be able to create a bit more stabilisation, so that's where the brace breath comes in. So you're going to create your 360-degree breath, and then just before you take your breath out, create a little outward push. So imagine you're farting, and then try and keep the muscles a little bit active as you're breathing out. So you're going to try and not let the muscles back away from the fingers. So 360-degree breath, outward push, breathe out, and then try and keep breathing now with those muscles slightly activated. So you don't want to really clench and tense. Obviously the amount that you need depends on what you're doing. So the heavier you're lifting, the more you're going to need to brace. So just do a couple more of these. Okay, so we're going to start with the flow now. So remember, this is nice relaxation, nice chilled flow. So we're just going to start by, we want to keep the lower back on the floor, so keep that neutral position, put the hands out to the side, shoulders 45 degrees, and we're just going to extend both feet away. And then as we're pulling them back in, bring them across to one side and look the opposite direction, and feel that nice stretch in the lower back. And then pull them back into the middle, using these muscles here in your abdomen. So it'll be the opposite side, so you're going to try and pull back and then extend the legs away again. If you find that when you're extending your legs away, you're going into this lumbar extension and you can't control that, just keep your knees bent and just go side to side. And then pull it back. Extend your legs, pull back in, Drop your legs the other way. Turn your head the opposite way so which the legs are going. Back in. Imagine you've got your feet on a bottle and you're trying to roll the bottle away. Keep breathing, focus on your breath throughout this one. Last one. Pull your legs back in. Straighten one leg. Grab hold of the opposite knee with the opposite hand and pull it across. And then you're going to look the opposite way. We're just going to hold this stretch. Keep breathing. Pull it back in. Take that leg straight, bring the other leg up and grab hold and pull it across. Bring that back and then bring both feet up to your, so that you're bending your hips and your knees, feet flat on the floor. And we're just going to do some shoulder flexion and rotations. So we're going to float our arms up into the air, float them backwards and then round. As we're taking the arms backwards, really think about what your rib cage and your pelvis are doing. And if you feel like when you're taking them back, your ribs are starting to flare, just stop before you feel like the ribs are flaring. Take another breath in, and then on the exhalation, try and just drop your arms back a little bit further. And if you need to sort of just reduce that range of movement so that you don't end up going into that rib flare and lumbar extension, then that's okay. So this movement is just coming from the shoulders. We don't want any movement of the body and of the ribs and pelvis and the lower back. Do one more. Arms back down by your sides. And then we're just going to now float one leg in the air and down. And float the other one and down. And then we're just going to alternate legs. Again, this movement is just coming from the hips, so we don't want any movement of the pelvis, of the spine. Keep breathing, keep creating your 360-degree breath. And now we're going to take both legs into the air. So with this, you're going to need to create your 360-degree breath, create your outward push, and lift. So what we don't want to happen when you lift is for your pelvis to tilt forwards, so like that. It wants to stay completely neutral with your back on the floor. So breathe, 360, outward push and lift. And lower, lift, lower. So really control the movement. If you need to, grab hold of your waist again. Feel if you can feel it inflating the whole way around. Last one, and then we're going to finish up in this 3-month supine position. If you find it hard to have your legs in the air, you can just rest your legs on a chair, or if you've got a big gym ball, put your feet on the gym ball. So what we don't want is for your like rectus or your front abdominal muscles to take over basically. This wants to be the core the whole way round, supporting your legs in the air. But if you feel like things are starting to shake or you're clenching your tummy muscles, that's a sign that it's too much for you, so you need to just put your legs on a chair or on a ball. But the 3-month supine position, your feet are going to be in a neutral position, so not turned inwards or outwards, slightly pointed towards your head. You want your feet slightly higher than your knees, knees over your hips, hips externally rotated. And we're just going to hold that position, and we're going to float our arms up into the air again and arms back, and we're doing our circles again, keeping the ribs and pelvis in connection. Focusing on our breath. Just keep bringing the arms up and round. Just do a couple more. Nice and controlled. Movement just from the shoulder, last one. Bring the knees to the chest, give the hip flexors a little rest, rock side to side, back up, and then we're going to go into the roll. So you are going to put your hands up into the air. We want to lift the head slightly, turn to the side that we're rolling to, and we're just going to roll to the side nice and slow. So try not to let yourself flop down and come and throw yourself back up. Try not to let your pelvis go first and then your shoulders, or your shoulders then your pelvis. So imagine you've got a Lego body, your body is moving as one, and when you land on your side you want to have this little gap here. You don't want to have a banana spine, so you want to be nice and straight. Okay, so we're going to go from side to side. So arms up, lift your head slightly, look the side you're going, and you're going to take the arm out to the side. Top hand is like reaching for something, and then go back, using that down arm to sort of push you back a little bit, and then go the opposite way. Keep breathing. Do one more each side. And you're going to finish on your left side, or whichever side you are facing me. We're going to come up into this low oblique sit. If you can't come up without letting the shoulder come forwards, just help yourself up with your other hand. So into the low oblique sit. And we're going to just turn into it. So forearms are going to be flat on the floor. And you want to try and keep your shoulders active, so don't let your shoulder blades collapse. So you're going to push the floor away with your forearms. And remember that external rotation and depression of the shoulders. So you're trying to use these muscles here to pull the shoulder sort of into external rotation and depression. So keep the shoulders active. And then what we want to try and do is transition the spine from a nice upright position where the back is trying to be, the upper back trying to be nice and flat. So you're going to try and pull your upper back towards the floor and keep the neck nice and neutral as well. And then we're going to transition between that and a flexed spine and rounded neck. So nice and straight, and then flexing, head down, and then go back into your nice flat back, neutral neck, but the whole time keeping your shoulders active. Don't let your shoulders collapse. So rounding and upright, nice and straight, round, nice and straight, round, do one more, rounding, so curving the spine and then flattening it out. And then we're going to go from this position into a pigeon. So we're going to go, you can see me, so pigeon stretch. So now the left leg, my left leg is underneath me, and what we want now is for the hands to be flat on the floor, shoulders active, nice, again, nice straight spine, and just holding that position, breathing into it, and then you're going to lower yourself down into a rounded position, and then come back up, lengthen the spine as you come back up, tuck the chin, shoulders externally rotated and depressed, and then down onto your forearms, round the spine, head down, and push back up, straight spine, down, round the spine, and now come back up, come into this oblique sit here. So you're going to push yourself back from your pigeon into your oblique sit, so with your mermaid legs. And then we're just going to do a little bit of hip rotation from side to side. So you're going to bring your knees up to the ceiling. And when you come into this tall sitting position, you want a nice straight spine. At the moment, I'm going to get you to do this in a minute, but for the moment we're going to be nice and tall, and we're going to take the legs round the other way and then pull them back up into this nice tall position. Back round. Alternating sides. Keep breathing. So at the moment we're just trying to help improve our internal and external rotation in our hips in a nice controlled way. So activating your core at the same time. As one hip internally rotates, the other externally rotates. And then we're just going to finish in this tall sit. And now we're going to go from this nice upright tall sit, and then we're going to flex the spine, head down. Feel that nice stretch in the spine, and then come back upright, tuck the chin, and then roll back, flexing the spine, tuck it in, tucking the head in, back up, nice upright position, keep breathing, flex the spine, back up, and now we're going to take our legs over to the other side, and we're going to do the same thing. So go into your lower oblique sit, bring the other forearm round. So your both forearms are flat on the floor. Shoulders active, so externally rotated and depressed. And you're going to go from this nice upright, flat spine into a rounding, pushing the floor away, straighten, nice and upright, flex, up, flex, keep the shoulders active so don't let them collapse, nice and upright, do one more. Now we're going to pull that leg through into your pigeon stretch again. Hands flat on the floor, nice and upright spine. And holding it there. And then come down onto your forearms and round the spine, head down. And up. Down and round. Up. Nice and upright. Down and round. And up. And now we're going to pull this, so curl the back foot under. And we're going to pull that front leg round to the back into a downward dog. So it's like you're an upside down V. Feel the stretch down the back of the legs. And then we're going to lower the knees down into bear. And down into quadruped. So with quadruped, we're going to first of all find our neutral spine again. So we want to tilt the pelvis like we did, lay on our backs backwards and forwards. So we've got flex spine, flexed lumbar spine and upper back, and flexed, extended lower back. So to find the neutral, again, we want to find that midpoint where your lower back should be nice and straight. So it shouldn't be in an extended position and it shouldn't be in a flex position. And then we want to think about our shoulders again, so externally rotated and depressed. Push the floor away with your hands, so you're not letting your shoulders collapse. And then we want to think about our upper backs. So we want to try and get our upper backs into an extended position. So we want to get away from this flexed spine, which a lot of us have, particularly from people who spend a lot of time sitting all day. So we want to try and pull the upper back into an extended position without going into lumbar extension. So when you're pulling your upper back down, if you've not got a lot of mobility in your upper back in this movement, quite often you'll go into this lumbar extension. So this is a really nice one. This has been my absolute game changer of an exercise, because I have always had particularly bad posture, and this has been a miracle for me. But it just takes practice. So pull your upper back down into extension. If you feel like your lower back goes into extension, try and keep your upper back where it is and just pull the lower back into a neutral position by tilting the pelvis underneath. And then we're just going to try and hold that position. And you should feel a nice mobilisation in your mid-back. So the point where you have your biggest curve, you'll feel a really nice mobilisation. And then we're just going to now hinge backwards, so we're flexing the hips. Keep the hands pushing down into the floor, so you're keeping those shoulders activated. And we're just flexing from the hip. We're not flexing the lower back, so the lower back wants to stay where it is. So when you go back, you don't want to round back here, and when you go forward, you don't want to go forward, like into extension. So we're keeping neutral, keeping the upper back flat, and the flexion is coming from the hip. And come forwards. Backwards and forwards, so we're going between flexing the hip and extending the hip. And now we're going to do a little bit of the opposite, so we're doing cat camels now, so we're going to arch the back all the way up, head down, and then arch the opposite direction. So taking the head up to the ceiling, and then the other way, and down, and up, and down. Okay, so now we're going to go into bear, so we're going to go from quadruped, so find your neutral, shoulders active, upper back flat, so every time reset, and then we're going to try and lift the bum in the air. So as you're doing it, what you don't want to happen is to go into this anterior tilt, so we want to keep neutral. So we're just going to lift and lower, lift, lower, lift into bear, and then you're just going to flex and extend the knees. So we're extending, flexing, trying to keep neutral spine. And then push into downward dog. Back down into bear, and we're going to now hinge backwards, so we're doing the same as what we did in quadruped, but we're hinging the hip, trying to keep the spine neutral. This is the one I always struggle with, so get myself reset, find my neutral, try and get my upper back nice and flat, lift, and then hinge the hip. Back, down, give your legs a little bit of a stretch off, and now we're going to go up, hinge back, walk the hands backwards into your squat. Try and again be nice and upright in the spine. I'm going to come forwards a little bit, so don't let yourself round. Upright, and then stand, down, up, down, up, down. Walk your hands back out into bear, and then take 1 foot forwards. So you're now in tripod, and we're just going to rotate one hand up to the ceiling, breathe, curl the back foot under, lift the back leg, back knee down, pull that leg back into bear again, take the right foot forwards, rotate up, curl the back foot under, lift the back leg, and then back down. Take the back leg back again into bear. When you come back into bear, try and get yourself into a good bear. Take that left foot forwards again, up into high kneeling. So, with high kneeling, we want to make sure, so we don't want to be too narrow, so pull that leg out to the side a little bit, and we don't want the pelvis to be at like a diagonal level. So your front leg, people quite often find that on that side the hips are a little bit wonky, so they go like this. So what we want to do is pull the pelvis and the hip down. So like imagine you're trying to externally rotate so that the pelvis is in line with the floor. And we want to make sure your pelvis is in neutral position as well. So not too anterior, not too posterior. Okay, so pelvis down. Knee wants to be tracking the second and third toe. Curl the back foot under, and we're just going to stand and take the back leg down and lower. As you're coming up, try not to let the knee cave inwards, and try not to let your pelvis shoot off to the side. So it's really controlling this movement. So keep that pelvis down, neutral spine. Create your breath, create your brace, and stand. And down, lower, and up. And lower, and up. And do one more. Hands back down, into bear, take the opposite leg, into high kneel again. Again, pelvis in line with the floor, curl the back foot under, neutral spine, breathing down into your abdomen, 360 degrees, create your brace, and stand. And lower, stand, and lower. Just trying to re-educate your body, trying to get it, doing it the right movement. So we're just slowing the movement right down, reinforcing a better pattern. If you don't lose your balance like I do, it's because I'm trying to talk and breathe and do the movement at the same time. It's quite tricky. I always find this the most difficult because I'm a bit unstable on my feet. And then last one. And then we're just going to do some roll downs to finish off. So, hands up, pull them down, roll down towards the floor, pull your hands back up into this like prayer position, arms up into the air, back down. When you go down, you can bend your knees if you need to. Back up. So when you're doing this, you're peeling your spine, so vertebrae by vertebrae. Arms up into the prayer. Down. back up. And last one. And that's all done for today.